So what is the best non-surgical treatment path to treat meniscus injuries? I'm Dr. John Tait. I'm a non-surgical orthopedic and regenerative medicine doctor. And what we talk about in my practice with my patients is how do we get you where you want to go, which is fixing an injury without surgery. So in other videos, I've talked a lot about meniscus injuries. We've talked about what is a meniscus, what does it do, how does it commonly get injured. So a quick recap, meniscus, this structure inside the knee, this white flexible cartilage inside the knee, what does it do? Helps with rotational movements, kind of directing forces in the knee. How does it get injured? Same mechanism. So rotational movements, most commonly. We can really squat down heavy and hard on that meniscus and really flex the knee down and pinch that meniscus and tear it that way too. But more commonly we see a rotational element where somebody plants and pivots and they tear a meniscus. Usually because they're a little bit older, a little bit less flexible. But again, this can happen in really young, super athletic people as well. So when we get into what is the tried and true conventional way to approach a meniscus tear without surgery, so first we got to separate, you have a meniscus that can actually get better without surgery. And those are the type that aren't catching and locking inside the joint. Because if you've had a meniscus tear and it's a flap tear that catches inside the joint mechanically every day, it's catching or locking, that's a really challenging thing to make go away sometimes without surgery. It's where I got to involve a colleague sometimes to do an arthroscopic procedure in an attempt to repair that meniscus or debride, which means cut away just a small amount of it so it's not being, or it's not caught up in the joint and restricting that motion. So if we go to the category that aren't locking, which is where we're going to have a lot more success with the non-surgical side of things, the tried and true methodology around injuries is, you've probably heard of the RICE method. So what does RICE stand for? It doesn't mean eat rice. It means rest it. It means ice it. It means compress it. So put a wrap or compression sleeve around it and then elevate it. Why would we want to do that? Well, all of those things are going to allow the body time and space to heal. If we elevate it, there's less swelling. If we put ice on it, there's less swelling. If we compress it, we keep it from swelling more. So the swelling aspect is just normal with an injury. And in the olden days, we used to think that, hey, all of that swelling is a bad thing. And it is to a point. But what's happening when the tissue gets injured is it's going to get inflamed. The tissue is going to swell a little bit because what's also happening mechanistically is the body has a way of communicating cellularly through chemical signals. So when we have injured tissue, it's giving off almost like a homing beacon, right? These chemical signals that then is going to attract other cells to that area to stimulate healing. And the cells that are being attracted there are platelets, stem cells, these things in our body, and what's inside of them really when they hit that area and release is growth factors, okay? So your body's chemically telling itself, other cells, what does it need to heal? Cells migrate into that area. So you have a cleanup crew of cells that clean up the damaged tissue. Then you have a repair mechanism that starts by release of those growth factors and signaling that tissue and really the cells, which are the building blocks of the tissue, how to heal. It's a really cool mechanism we have in the body. This is why we heal things. If you get a cut on your finger, it heals itself. You don't have to think about it. You are not actively doing rehab daily for a skin tear. Similarly for this, if you tear a meniscus in your knee or it's a ligament or tendon tear, it's going to go through that same mechanism. Okay, cells are going to be attracted into the area. We're going to dump some growth factors. We're going to signal this cascade of healing. And it starts with the injury. Then it starts with inflammation. And that's why we swell. So again, that old protocol was the swelling is bad. The swelling is actually useful because it's signaling the next cascade of events that need to happen to bring in the cellular machinery to actually heal the tissue. The worst thing we can do, from my perspective and modern ways of thinking, so we'll contrast the RICE method with the meat method. So you don't eat more meat. What you do is you move it, right? So now we think early movement is actually better. We want to move because when we sit there and we just lay around, the tissue actually, when we're trying to immobilize it and just keep it off it, like everything stagnates. The fluid's not being returned through that area of injury. The pumping mechanism, the muscles aren't returning blood flow or lymphatic flow. So if we want to clear all that cellular trash from the injury, we actually want to be doing a little bit of motion and movement. This doesn't mean hard exercise, it just means moving the knee. And sometimes what I have people doing is just stationary bike where they're not loading a lot of weight through the knee, and they're able to just circulate that knee and really circulate the fluid and around that tissue and move waste products out of the area of injury, but move nutrition into that. So again, it's movement based, it's exercise based, again, modified, and it's then analgesia. So MEA, the A is analgesia, which means pain control. So what can we do for pain control? In other videos, I've talked about natural things that I use. I'm a proponent of using topical things on the area. This means you apply it to the source of injury. Topical things like arnica, boswellia, CBD compounds are really great for inflammation that you can use to treat locally. The other thing we use for a lot of people are active recovery braces or sleeves. There's a company in Creditware that makes an interesting sleeve that we use a lot with their patients. And when you put this on the area, I have one actually. How convenient. I have one right here. This is for my elbow. But there's metals inside of this that actually work as a semiconductor. So when your body heat heats that sleeve up, it actually increases blood flow around this area that you're trying to heal. And it also has been shown by their company to decrease inflammation. So this is more of an active approach rather than compression sleeves that are trying to just limit that swelling aspect of the knee. So the last one then would be therapy. So then how can we take people through a physical therapy program designed to, again, look at mechanically how they're moving, flexing, rotating as the body's walking through these stages of healing, because most of these injuries are going to take a minimum of 4 to 6 weeks to heal, some of them longer. So again, if you're not a pro athlete and you have to get back on the field ASAP, you may not be going to surgery. With the types of tears that we're talking about, the non-mechanical, we're trying to keep you from surgery if possible. So that's the progression. It's movement, it's the right kind of exercise, pain relief, analgesia, and then into physical therapy so we can start working mechanically on just improving strength around that joint, improving your mechanics. When all those things are done and fail, that's what brings a lot of people into my office to think about other things we can use to augment healing. And the top two things that we're using in that space and have for many years are platelets and stem cells. So I was talking about that cellular machinery earlier, and those cells that are coming into those areas are platelets and stem cells. Those cells are designed, they're out on patrol in our body. When we have an injury, they migrate to that area and they release the growth factors to stimulate healing. So very simply, we can just think about supplying the area that needs more of those cells with more cells. So we can extract cells from one's arm, one's bone marrow. That tissue has a reservoir of a fraction of stem cell or growth factors. All those can be used to inject into this area if you have an injured meniscus, and you can drop those cells into this area. Those growth factors will go to work to accelerate that healing. So it's one of the best things we have in non-surgical treatment, because on the flip of that, a lot of people may get cortisone injections, and cortisone actually will work very good to reduce inflammation, but it'll work against you on the healing side of things. When you put steroid in there, it will metabolically cause problems for the tissue in there at the cellular level. If we put too high a concentration of steroid into a knee, it actually kills the cartilage. It actually limits your capacity to heal. So it's one of the things that I don't recommend people do unless they're miserable and the knee's big and swollen and we want to drain it and then put a microdose of steroid in there to settle it down. So if we get to the final piece of what do I use around the cell treatments, we can use a couple newer technologies. Maybe you've heard of these already, but Shockwave is think of it as a percussive massage. So you use a massage tool on this to pulse the tissue with a mechanical sound wave. And what that can do is stimulate perfusion, blood flow to help that healing. It can decrease inflammation and again, stimulate more of that metabolism in the cells that we want, that energetics of the cells that we want. The other thing we use a lot is laser, like a class 4 deep tissue laser can stimulate healing. And if you put Shockwave and laser together with something like PRP or stem cell, you have a very powerful combination to treat a lot of these injuries successfully without surgery. So hopefully that helped you kind of walk through the old school, the new school. What are we doing in modern non-surgical orthopedic treatment for meniscus injuries? If you like the content, like it. If you want to see more content like this when we put new videos out, subscribe to the channel. And if you have any comments, drop them below. If there's any way we can help you, look at the notes in the video below. There's a link there that will take you over to a page. That page, you can drop some comments in there about the issue you're struggling with. And if there's anything we can do to help you, my team will dig in on that case and see if we're a great fit to work together.